Get started. Hi, everyone who is joining us. My name is Marcus Bose. I'm a pediatric dermatologist at the University of Washington and Seattle Children's Hospital, and I'm also chair of the Society for Pediatric Dermatology's Mentorship Committee. And we decide to put on this webinar. We do it annually just to give medical students an opportunity to understand more about pediatric dermatology and what a career looks like in pediatric dermatology. What you may or may not know is that our specialty is the best in all of the House of Medicine, but there are too few of us who have recognized and answered the call to pediatric dermatology with just around 400 board certified pediatric dermatologists in the United States. So we want to share with you our experiences and hopefully get you excited and interested and curious about pediatric dermatology. So that's all you're going to hear from me. I'm mostly just kind of the MC, but want to introduce our three panelists who are here. Dr. Brandy Kenner-Bell, who is at Northwestern University, Dr. Jennifer Wong, who's at Harvard and Boston Children's, and Dr. Melinda Jen at the Children's Hospital of Philadelphia. And I'm going to allow them the opportunity just to kind of introduce themselves and also say sort of like what drew them to pediatric dermatology. Many of us didn't even realize that this was a subspecialty until maybe later on in our medical education or even our careers. So if each of you could kind of talk about your journey, that'd be great. And why don't we start with Dr. Kennerbell?
Awesome. Thanks for having me. So I was one of those people that didn't know pediatric dermatology was a thing. I had always wanted to be a pediatrician. That was like from day one when I was like 3 years old. I have an essay that I like wrote out or whatever. So I was actually fully matched in pediatrics my fourth year of medical school when I did a peds derm rotation. I went to Baylor. And Denise Metry and Mo Levy were my attendings, and I enjoyed it, but I was like, I was a pediatrician, like it wasn't even a consideration. Not to mention, I did not get 4,000 on my step and I had done no research. And so I was like, this is not an option for me, even if I, want. So I went and did my PEDS residency and I would see Denise Metry on the wards and she would say things like, this is what you should be doing. This is where you want to be. Are you ready to come to the light? And I was like, no, what are you talking about? And then if you've ever been in a residency, which most of you have not, they're hard. And so I remember one day I came home and I was particularly distraught over the hardness of my day. And I was like, I want to be a pediatric dermatologist. And it was literally a eureka moment, just like that. The next day, I went and met with Denise, and I was like, okay, how do I do this? And next thing I know, I was applying during my second year of PEDS residency. And by some sort of miracle, I matched. I think, probably because I was committed to PEDS derm. And if there are 400 of us now, this was 20 years ago, actually more than that. Like 20, I'm old, like 20 something years ago. And so there's probably half that number. And so I think there were programs that were really committed to trying to train and, put more peds derms out there. And so I matched and I finished my third year of peds and then went directly into derm residency. I never practiced as a pediatrician, though I was board certified. And it's the perfect specialty for me. It is, I love being an expert. I love knowing a lot about one thing. I love that I'm like where the rubber meets the road when people come to see me. It's because they've seen all the other people. Nobody can help them. Nobody could fix them. Nobody knows what they have. And I do. Because nobody knows derm. And even within derm, nobody knows peds derm. So that's why we're the best. Just period, hands down.
Thank you. Dr. Wong, you're next on my screen.
Okay, that was awesome, Brandy. I loved hearing your story. I don't think I can top that. Hi, everyone. My name is Jen Huang. I'm a pediatric dermatologist at Boston Children's Hospital. Um, a little bit about me. I was born in Taiwan and moved to the United States when I was 6. So I'm an immigrant, but have been here a long time and grew up in New Jersey. And I never thought I wanted to become a doctor. So when I was 3, I was not writing an essay for ERAS, but I knew I always wanted to do something that would help. I don't know, this sounds super cheesy, but like help society and make a difference. And so I thought I wanted to be a social worker. But anyway, I'm going to spare you the details, but I ultimately decided that I wanted to become a doctor and I really wanted to become a pediatrician. So some of this story is similar to Brandy's in that when I went to medical school, I knew I wanted to take care of kids. And I thought the only real way to do that was to do a pediatrics residency. And I also knew that I was the type of person that would thrive in a field where I could really specialize in something, like know something a small amount of information really, really well. And so when I went into PEDS residency, I knew I wanted to subspecialize, but I felt a little bit lost because I couldn't find that specialty that I really, that got me excited. And until I had an experience when I was in the NICU, and we were responsible for delivering babies in the NICU, and we had a baby delivered with a very severe skin disease called what was previously called harlequin ichthyosis. And that's when I was introduced to a couple of pediatric dermatologists at Columbia, which is where I did my PEDS residency, Maria Garzon and Kim Morrell. And I learned about the disease that this baby had, and also learned about the field, and realized that this was my little corner, this my space that I could, learn and become really good at, and grow a lot of expertise and depth in. And I just really, really loved it. And I loved it because, going back to my interest in kind of doing more for society, I realized there weren't that many people. And actually, a lot of what Brandy said resonates with me. I feel like in this field, because there aren't very many of us, and because it takes a lot of training and expertise, you can really make a difference. Um, you can be the person that really changes the patient's life or a family's life, and provide insight that others maybe couldn't. So that's my story. I really love my job.
Thank you. Dr. Jen.
So I have a similar journey to Brandy and Jen. But I went to medical school actually thinking that I was going to be a pediatric surgeon. I knew I wanted to work with kids, and I knew I wanted to do something with my hands, something procedural. And then I shadowed and I worked a lot with the ped surgeons at medical school, and I realized these are not my people. It's like cool what they do, but this is not where I should be. And so then I said, I'm a pediatrician at heart. I'm going to apply for peds. And I was in fourth year. My personal statement was all written. My letters of recommendation were all requested. ERAS was in process, and I had a derm actually elective scheduled. So I went thinking that this is something I should kind of know about if I'm going to be a pediatrician, because there are so many skin problems in kids. And then I went and I thought, this is really cool. Like this is a really interesting field, but I want to be a pediatrician. And so this is really cool, but this is not for me. And then at the very end of my rotation, I met with the program director at that time of the medical school at Einstein. And I told him, this is really cool. I really liked it, but I'm going to be a pediatrician. I really want to work with kids. And he said, there's a thing called pediatric dermatology. And I was like, really? I actually never heard that. We didn't have one at Einstein at that time. And so I was like, oh, okay. I kind of like let that marinate a little bit, but thought I'm going to be a pediatrician. And at that point I had evolved to thinking I'm going to be a pediatric interventional cardiologist. In my mind, I was choosing very specific things. But I knew I loved, kind of how it was like plumbing. The heart was like plumbing, and I would do to procedures. And it was just I could wrap my mind around it really well. And I thought that's what I was going to do. And then I was applying, and I met Albert Yan, who some of you may know, who has mentored some of us. And he's, if you know Albert, he's just remarkable. And he kind of like lit the spark again, like just really lit it and said, you can do this, you should do it. And so I matched in peds, and I did 2 years because I got a spot outside the match during my second year. So I started during what would have been my third year of peds. I started derm residency, and have not looked back. I love it. And I think I echo everything that Brandy and Jen said, that it's like, I really enjoy knowing something well, but also all these families kind of are told things, that are incomplete or just misinformation, really. And then they're searching, they're confused, they get to us and they're just like, I don't even know. Like, I've tried everything, or I don't know what it is. Nobody knows what it is. When I went to the doctor, they called everyone in the office to see my child, and they don't know. And then they get to us and we're like, we know. we know what this is. We can help you. And we've treated other kids like this before. This is the plan. And just like being able to relieve that like anxiety in a parent. And I think I appreciate all the more now as a parent, just how we worry so much about our kids. And for these parents to come to us full of worry and not knowing, I think that really distresses them a lot. And for us to be able to say, I can take that off you a little bit because I have a plan. Even if we don't know specifically what they have, we have a plan. And I think that really helps them relieve a lot of that worry to know that they are in hands of somebody who knows what to do next and has an approach for their child.
Thank you. I know I said that I wasn't gonna add, but I have a big mouth and I can't always help myself, which the three of you all know, and the attendees will now know too. But there's two things I just want to say. Number one, the other misinformation that we have to deal with this day is TikTok, right? Which is also like a fun, and I say I love that part of Pete's Derm, just like interacting and be like, what are the children like talking about and like discovering, and what are they unfortunately doing to their skin in some cases, and like let's like change that. And also that we can help people before they start having bad habits that like you can't undo, right? Like such a cool part of just peds in general. The real point that I want to make though is that even though our amazing panelists all went through some form of peds residency, you do not need to do that to become a pediatric dermatologist. So all you need is an intern year. Many great pediatric dermatologists like figured out late they did like a medicine intern year or transition year, or they didn't know that they want to be peds derm until they were doing their dermatology residency. So I just want to make sure that no one thinks that they have to go through pediatrics to get to dermatology. But I think that the stories that you all shared are very common, that like that's where that spark was lit. You knew you loved kids, but you just didn't know that like the skin was the part of it. Melinda, yeah, you got something to
I was going to
add.
say, some people that I know took even longer. They practiced in adult derm for a period of time, a year, two, three, before they realized that they wanted to be a pediatric dermatologist. And some of those people are, I mean, like real leaders in our field. So it's not like they just kind of like, well, maybe I want to do this. They are like all in. And so at any point, this realization can happen. It can happen early. It can happen in med school. It can happen in residency. It can happen after residency. So there's no real like timeline.
Thank you for sharing that. Um, I just want to the attendees, if you have questions, you can feel free to put them in the chat. I will try to monitor that and either answer them myself to like some best of my ability if it's like a very clear answer, or try to pose it to the panelists. Um, but why don't we move along a little bit? Jen, I'll start with you on this question. Tell us a little bit like what is your career like, right? Are you just seeing patients all week long? What is the mix of your practice, and how do you keep things fun and exciting, week after week and year after year?
Yeah. Um, like I said, I really, really love my job, and I love it because I do different things every day. And so I do take care of patients, but then I also spend a lot of time doing research and teaching, and also now some administrative work. Um, and I think one of the beauties of dermatology in general is that there is the ability to have some flexibility with your job and how you spend your time. So if you're someone who can't sit still and you like to keep busy and you like to do different things, dermatology is a great specialty. And peds derm specifically, there's just so many opportunities. Wherever you work to be able to get engaged, because there aren't very many of us. There's so much need for someone like us who to teach, to do research, or to be a mentor, and all those things. So currently, our I do 4 clinics a week, which means that I spend 2 days of my week seeing patients, and that's in the clinic. And then I also spend a day a week, one of those days also taking care of inpatients, doing consults in the hospital for dermatology at Boston Children's, so only children. And then the rest of my time I spend, I'm currently the section chief for dermatology at Children's, so we have 16 now pediatric dermatologists. I know there's a lot of us. We have 11 full-time and 5 part-time people. And so there's a lot of people management and thinking about nurses and clinic and how missed appointments and all the staffing, and which I actually really, really love. And also part of that is interfacing with other specialties within the hospital and collaborating with them and coming up with plans to provide care for specific kinds of patients. And so there's a lot of collaboration and a lot of time spent in meetings. And learning about finances. And then I'll just add that previously I stepped down in September from a role as residency program director. And so at that time, when I was residency program director, that took about 40% of my time. And you'll hear academic physicians talk about their time in percentages, because that's how we think about, like, that's how we're paid and how we think about our days. But at that time, 40% of my time was running the residency. And then I did 3 clinics a week. And the rest of the time, again, like teaching and doing research and all of that.
Awesome. Thank you. Dr. Kennebell, what
So
does your look like?
I I mean I am also in academic medicine, but my day is probably almost the flip of Jen's. When I first started, I was 90% clinical. So that means I did 8 half day or 4 full day clinics a week, and then I had an extra day for admin and teaching and stuff like that. Over the years, my role has evolved. I do a lot more teaching and mentoring, especially with med students. I have some official roles in mentoring med students that now give me uh, compensated time. And so that's decreased my clinic load. But I have maintained a hefty clinic load despite that. And I ended up getting involved in doing a lot of things outside of my actual job. And so I do a lot of speaking and teaching of especially pediatricians. And so I travel a lot around the country giving lectures, or, during COVID, giving online lectures. I got very involved in the SPD, which is the Society for Pediatric Dermatology. I got very involved with the American Academy of Pediatrics, the section on dermatology. I'm on their executive board now. So I spend a lot of time doing work things that I don't actually get paid for. And if you want to talk about that, then we'll talk about that offline, because that's not the way to go. But so, but this, I spent a lot of time doing a lot of things, and I will say that I have enjoyed my transition into more academic based practice, because seeing patients is a lot, and it's really tough, and it takes a lot to you give a lot to your patients every day, and it does take a lot out of you, and so sometimes you need other things that fill you back up. And teaching and working with med students, especially in a mentoring role, an official mentoring role, has been one of those things that fills me back up. And so I've really enjoyed that transition. And I always tell my students that, the road in medicine seems so straight for so many years. When you're in high school and in college and then in medical school, you've got it planned out. You've always, like Melinda was saying, she had, down to letter, what she was going to do. And then you realize that, like, life is not necessarily like that all the time. And sometimes you think you're going in one direction only to find out that's not the right direction for you. And it's totally okay. It's okay to make a U-turn. It's okay to take a left instead of a right. All of that is okay. And as long as you're staying true to what you really want out of life, it's gonna be fine. And sometimes the road gets blocked in front of you. You think you want something, you think that you're on the road to something, and it doesn't happen that way. And so you've got to pivot. You got to do something different to get maybe where you want to be, or do something different than you thought you wanted to do. And all of that is okay. The idea is that you just keep putting one foot in front of the other, keep moving forward, and you will end up where you're supposed to be.
Thank you. Melinda, what about you?
I don't know if I can follow that, Randy. I mean, it's so
Agreed.
true. So I know. I'm like, yes, I'm inspired. But it's very true. So right now, I do about 5.25 clinics a week, if you average it over a month. And half of my clinical time is procedural. The rest of my time, I'm working, I do administrative work and teaching. And so the roles I have are the director of clinical operations for our group. And then I lead the surgery and laser program and pigmented lesion clinic in our group. And so I didn't think, I actually, funny is that I decided, I was like, I'm not going to do private practice ever, because I don't ever want to deal with the money. I don't want to have to figure out where the money's going and coming from, like who's reimbursing me and who's not reimbursing me. And like Brandy said, life takes you where it takes you. And I cannot tell you how in the depths I am about our reimbursement, who's paying us, following the trail of money and audits. And I am like knee deep in spreadsheets, and I never thought I would be. But maybe it's because my mom's an accountant that I actually really enjoy it. And so I have kind of found something that I enjoy, which I thought was something that I would, that I never wanted to deal with in my life. But that's part of my role as kind of like in clinic, directing clinic operations, is like, okay, who's paying us, what codes are being paid. I'm chasing money, I'm going after, our accounts receivable and all the stuff that I never ever wanted to do. But I like it. And then I do a lot of procedural work otherwise, which I really enjoy. It's the theme of like, I thought I was going to be a surgeon, a pediatric surgeon, then I thought I was going to be an interventional cardiologist. I always knew that I wanted to kind of be active procedurally, and thankfully I've been allowed to do that.
Awesome. So it kind of sounds like for all of you, right? It's like following your like listening to the inside, right? And like letting that sort of guide you down your path and taking advantage of opportunities when they come up, like within our discipline too. Um, so there is a question here that from the chat that I want to post to whoever of you wants to answer this, and maybe you can also include a little bit about like compensation too. So it says, what are the settings that peds derm practice in? Like because we're all in academia, and the majority of our colleagues are in academia. But if any of you have perspective, and I have some too, if no one does, about like what are other sort of like models that you might work in as a pediatric dermatologist. And if anyone wants to address kind of compensation, I know that sometimes people get a little bit antsy. They're like, well, I don't know, like, am I not going to be paid very well because I'm a pediatric dermatologist as opposed to a dermatologist? Um, any of your thoughts on those things?
I can start. I think that the reason most of us are in academics is for so long, pediatric dermatology was such a small non-specialty. I mean, we didn't get a board until what, 15, 20 years ago at the most, that those were the only spaces that could support peds derms because, again, the money aspect, because we don't bill and collect as much as most adult derms. So it was only in academic spaces that they could support peds derms. Over the years, many more peds derms have gone on to open private practices and different settings. Now, whether or not they solely are seeing pediatrics, I think is an issue depending upon where they set up. So location is huge in terms of like what type of practice is available to you. I think many of them do see, some adult patients because again, the financial piece of that becomes a little bit tricky when you're looking at reimbursements and things like that. Because in medicine, procedures still pay. In peds derms, we avoid procedures like the plague. Like we try not to do procedures on kids that are not necessary. I also consider myself a proceduralist, Melinda. So I'm not averse to procedures, but somebody asked me the other day about how often do you do a biopsy on a little kid? And I was like, maybe once every few months. You know what I mean? It's just not something that we do. We very comfortable in the unknown space. I feel like adult derms, they biopsy everything. You don't know what it is biopsy. We're like, it doesn't look dangerous. You know what I mean? So anyway, we'll just live in that zone of unknown. But anyway, so a lot more of us do are in private practice now. There's multi-specialty groups also that now that are dermatologists, and you can be the peds derm in that multi-specialty private practice group. Again, because a lot of them will support that peds part of the practice. It really depends on the practice. There are some that are like, no, you need to carry your own weight. You need to eat what you kill. And so if you come here, you're going to have to either see 1,000 patients a day or see some adults to make up for that. So I think now we have a much broader set of options as peds derms in terms of what we want to do. But the majority of us are still in academics, like I said, because I think academics supports peds derm, which is a lot harder to do in the private setting. As far as compensation, location. So depending upon where you practice, your salary can vary widely. I will say that you will not be a poor person as a pediatric dermatologist. Are you going to make the same as a Mohs surgeon? No. So, let that go. But you will be, well compensated for what you do in the grand scheme of things. But where you practice, I think, has a huge impact on your salary, whether you're in a public institution versus a private institution, I think has a big influence on your salary. And then I was at the ABD meeting this weekend, the American Board of Dermatology meeting this weekend, and one of the other PZerms was saying that their billing, nowadays actually is comparable to the medical derms in their practice, and so we're getting better reimbursement. The coding and things changed. How many years was that? 2 years ago or whatever, which allow for the time that we spend on our patients to be better compensated as opposed to older compensation models that, again, rely more heavily on procedures and things like that. Okay, I'll shut up. Go ahead.
No, I just didn't want to forget that I was going to add what I was going to say. I was going to add that there's also privademics, which is like a little meld of private practice and academics. And so it's mainly like private practice groups who are affiliated with an academic institution, and then they they have a residence and they go and they teach. But the main model of kind of their practice is kind of like a more private practice based. And so there is even like the Venn diagram of like academic, private practice. Now we have like the middle of both. And so there really is the whole spectrum that you can do. And then in terms of compensation, I think that the SPD has really tried to move the needle a lot on this, is because they've done multiple kind of compensation surveys. And I know even our group has taken that data and gone to higher ups and said, look, this is the data out there. This is what we should be compensated. This is what our peers are getting. And, I can say from firsthand experience that has moved the compensation needle a lot for us. And like Brandy said, having the changes in reimbursement from insurance being based on time, like basically your medical decision making is the bulk of what your compensation is. And that has made a huge difference, because a lot of people say they don't want to do Pete's Derm because like it's so much time, you don't get to see the same number of patients. But guess what? Now the amount of time that I spend counseling these families, I can bill on time. And then that levels the playing field a little bit. And that's like honestly what medicine should be about, is like how much time and thought you're putting into the person, and not how many little like AKs you're zapping off of them or are biopsying. And so I do think that those have helped a lot. And if you look at kind of the starting salary of pediatric dermatologists, it has gone up significantly since I started. Whereas now I'm like, oh my gosh, I can't believe I worked for that little. And I worked 8 clinics a week for that. So we have come far, and I think that we'll continue to kind of try to level the playing field as much as we can.
Yeah, I would agree. I don't think anyone is going to be having difficulty feeding themselves on a pediatric dermatology salary. So, um, one other thing that I would add too, right? Like group practices like Kaiser, right, are another option where it's like not quite academics, not quite private practice, where you have someone sort of like managing things. So, we as pediatric dermatologists exist in all spaces. So if there's a place that you feel is like good for you, it's out there somewhere. I'm going to shift gears a little bit, and Dr. Wang, I'm going to ask you as a previous program director. There's a question down here. Since dermatology is so competitive and there's so few spots in Peds Derm, what advice do you have for students who want to get more involved early and be more competitive applicants? And could you maybe talk about different training paths as a like way to get to Peds Derm, especially with the new kind of ACGME track that we have for people who have done Peds residencies?
Yeah. I would first say don't sell yourself short if you don't feel like you're a cookie cutter dermatology applicant. I think that, as you could hear from some of the things that we were saying earlier, some people may give up a little too early because they don't think they're the type of candidate that a program is looking for. And that's just not true. And I don't want you to be scared from applying. because you don't think that you're the right candidate. Because most likely, if you're thinking about peds derm, you're not a typical derm candidate, and we want you. And I think part of the problem, or the reason why we don't have so many people interested in peds derm, is those people who think that they're interested may not necessarily take the leap and apply. So I'll just say that first. If you happen to know you want to do peds derm or dermatology early, I think the number one thing for you to identify is a mentor who believes in you. Not a research project, not papers to be published, but one person. And it may take a few interviews, and that means you interviewing potential mentors to find that person who really believes in you, thinks you can do it, and is willing to advocate for you. And it has to be a really genuine relationship. And you also have to have mutual respect for that person and develop a sincere relationship. And I really think that you could hear again from how each of us were talking. We talked about one or two people that really showed us the way, and they continue to be our mentors and our lifelong friends. And I think that that's what's going to get you to where you want to be, someone who will believe in you and is willing to take you where you want to go, and is willing to tell you the truth about what it takes to get there. And there was another part to that question. Oh, what are about the ACDME tracks? Yeah, I think that so one track, there are a couple of programs that offer now spots for someone who's already done a peds residency, and that's going to be a select few people who are eligible for that. And there are other programs that are open for people who have a strong interest in peds derm. I think if you're thinking about peds derm, you haven't done a peds residency, you should definitely look at those tracks, but not exclude yourself from others. I think just because a program doesn't have a peds derm track doesn't mean they're not interested in recruiting pediatric dermatologists. There could be a number of reasons why that have nothing to do with that. And identifying yourself as someone who's really interested in that area. I think many programs know that there's a need, and will be particularly interested in someone if that program itself has pediatric dermatologists. I think it's maybe less likely for a program to recognize the importance of that if there is no pediatric dermatologist in their program, just because there's no pediatric dermatologist who has a seat at the table with on the selection committee. So again, I would think about any program that has a strong pediatric dermatology presence and applying and expressing your interest in addition to the tracks that are offered.
Thank
Just
you.
to add a plug is, we all, there are a few, I know there are some places in progress, and we have one at Penn where it's a track where you do an intern year that you match into an intern year in peds that then leads you into derm residency, so that there's another another avenue to go for peds derm. Shameless plug.
I'm going to put in my own shameless plug as chair of the mentorship committee. There are awards that we have specifically for medical students. They're mentorship awards. And we are really trying to emphasize that we want this to be a clinical experience, not a like another publication, not some project, right? I think medical students get so wrapped up in like project, I need to have 8,000 things on my residency application. We want to know who you are, and we want to know that you're sincere about your interest in peds derm, and we want to know that you're in it for the long haul, and you're going to be someone who is like excited about taking care of kids. And like we're a small community, right? 400 people sounds like a lot, but in a medical society it is tiny. So like when we have our annual meeting, and if you aren't doing anything this July, please come to it. It's in Seattle. I'm chairing it. It's gonna be a party. Like we're like, yeah, we can't wait to get drinks and catch up and like all this fun, right? That's the type of colleague that we want. And so, to Dr. Wang's point, right? Like having a mentor who can speak to and say, like, yes, this person is the real deal, and I'm gonna write you an amazing letter because I spent a month with you or however long it is, makes such a huge difference. So we have these. If you're like, I don't even know where to start because I don't have a derm program, I don't have peds derm in my institution, this is the mentorship opportunity for you to find your Denise Metri, to find your Albert Yan, to find your Maria Garzon or your Melinda Jen or Brandy Kenner Bell or Jen Wong, right? Like we want to help you become one of our colleagues because we need more people who care about kids. So please like look into that if you're interested.
And just kind of to piggyback off that and what Jen said is, what you want to find is a mentor first. And so this is a way to find that mentor. So it doesn't have to be like, I want to do research on, GVHD. It's more like, I want to learn more about GVHD in kids. This is a person who is an expert. I want to spend time with them. And then when you spend time with them, almost all those other questions, all those things come naturally from there. But it comes from a true interest of yours, a true clinical interest, if you start there and then you find someone who kind of matches your clinical interest. And that's a much better pairing than saying, I need to find someone who will help me publish 5 papers before I submit my ERAS in September. Like that's a much more forced relationship. And I think the true, genuine ones, you can tell when you see the applications that that's what they are.
I want to switch gears a little bit. There's a couple questions here that talk about sort of like outreach efforts, and I think it speaks to sort of like a broader question, right? Like, who are our patients? What do they look like? What backgrounds do they represent? What sort of needs do our patients have that we can help with? Are there opportunities for people who want to work with minoritized populations in pediatric dermatology? If any of you would be willing to share your experiences, the diversity of patients that we serve.
I having been so and still very heavily clinical, and I practice both at our main hospital, which is in the city of Chicago, and our suburban locations, which some of them are pretty far out. And so I have a humongous like patient mix. I can't imagine a person that I don't see. And that includes every demographic category. So I'm not just talking about race, I'm talking about socioeconomic status, all of that. And so I think that depending upon where you practice, obviously, that's going to heavily color that one way or the other. I happen to be interested in skin of color, and so I get a lot of patients directed my way simply because the grapevine of patients is such that patients tell each other, oh yeah, you should go see this person because they know they know black skin or whatever. And so I get a lot of patient referrals just through the grapevine. I do a lot of community stuff. So I put myself out there, just speaking at community events or local health fairs and things like that, to increase knowledge about that we exist even in Chicago, where we have a couple robust pediatric dermatology programs. There's still communities in Chicago that don't have access, that don't know we exist, and so I do a lot of community outreach on my own. This is not necessarily part of our department, but something that I do on my own. And I think that there are other places that may have very organized programs that exist. I know a couple of medical students that I mentor here at Northwestern have started one. So it's a community outreach program specifically designed to reach out to communities of color. It's an amazing program. They're doing amazing things. And so I think where there's a will, there's a way. And so if that's something you are interested in, you will be able to find that, even if you have to start it yourself.
I guess I'll chime in and say, I work in downtown Philadelphia, and we similarly kind of see all sorts of patients. Like I live and I work in the city, and I used to go out to one of our satellites where it was very much more suburban. Like they would get the first day of hunting season off. It was like so rural. And so we would see kids out there when I used to go to my satellite, but then I would also see kids in the city, all sorts of skin types. We have a very large non-English speaking population. When we had the language services from the hospital come and speak to us, they told us that we in dermatology had the greatest number of patients who were not non-English speaking and requiring interpreter services. And I was like, yeah, because it kind of feels like that. But we're supported very well. But we see a real wide range in terms of skin color, socioeconomic backgrounds, a real range. And we even have international patients who come to kind of be cared at the institution, who we then also take care of too.
Just add that I think they say that 25% of pediatric complaints or chief complaints are about the skin. So skin disease is really, really prevalent across all pediatric populations. However, access continues to be a major issue because there aren't that many of us, right? So you think about like who ends up at our door or in our clinic, no matter where we work. It's people who have resources, know people, know the right person to email. So I think that as pediatric dermatologists, we really have an obligation. Like Melinda and Brandy are talking about, to go out there and make an effort to educate and reach out to those who wouldn't necessarily show up at our door. Um, in Boston, at our hospital, we work with Boston Healthcare for the homeless, and that's like a real privilege to be able to work with them and um, work with families who are experiencing homelessness, and we do a lot of patient education with their families. There's a daycare that the Boston Healthcare for the Homeless runs, which is really incredible. And so the students get involved in that, and I think that's a lot of fun and also eye-opening for students to engage with families that don't usually show up at our hospital. And then to Brandy's point about the clinic, we started a clinic a couple of years ago that's run by students and faculty that's specifically for peds derm and for those who have Mass Health, which is our Medicaid, to try to teach students how to think about prescribing medications or recommending treatment in resource limited settings. So there's so much that you could do as a budding pediatric dermatologist, and there is a lot of need no matter where you work. But it's important for all of us to make a little effort.
And also to add, telemedicine is also kind of a growing, e-consults are a growing kind of field in medicine in general, but in derm and peds derm. And now there's some reimbursement from insurances for e-consults. And so that's another way to reach people who can't come to us, is through their, provider somewhere else, to then give them that recommendation and they can implement a plan before the person even gets to us directly.
One thing that I want to point out that you all are saying without saying it is like how much the three of you, but I think you're a great representative, like cross section of our society, like care about our patients, right? Like it's not just like, oh, here's a skin condition that just happened to present at my door. It's like, oh, there is a group of people or a single person in front of me who needs my help. And it's really a gift when I think about like my own practice to think like, oh, I'm not just like helping this person like with their skin. I'm teaching them, hopefully, what good medical care looks like and what respectful medical care looks like and what they should be able to expect for the rest of their lives. Because kids, right, like they don't want to go to the doctor, but if you make it fun for them and you're like, oh no, I care about you, and they connect with you, it teaches them how to navigate the healthcare system. And when you are being proactive and making it a good experience before the patient even comes in the room, when you are going to find them before they even know that they need you, they feel cared for. It makes such a huge difference, and y'all are doing it every day. And it's something that I really like to emphasize to the residents in my program and to all of you who are choosing this path in medicine, right? It's hard work and it's a gift every day that we have the opportunity to change people's lives. And it might not feel like the biggest thing, but even just like relieving a child of their eczema, giving them a good night's sleep, it really is like we have the data to show why it's life changing. They sleep better, they perform better in school, they can pay attention, they get better jobs, right? Like it makes a huge difference. And for me, and one of the reasons why I love Peds Derm is because I just feel like, yeah, like maybe like we have like moved the path a little bit and now this child is just going upward and onward, and I'll never know, but it feels good to make a difference. And I just can't say enough like how grateful I am to hear your stories and all the things that you and your institutions are doing, because people need us, and that's why I want all the attendees to be inspired so they come and join us and help us with this mission. It's really a very gratifying career, for sure, for sure.
I have a story.
um
I have a story to happen
I want to
today.
hear it.
So relevant to this. So I started, like I said, this is my 15th year in practice or whatever. And one of my very first patients was a little 7-year-old girl, and she came in for eczema. And as P's derms, we know, we see a ton of eczema, but we see so much not eczema. And it turns out she had been treated for this terrible eczema on one leg that had not gotten better. And she had something called morphia, which is a devastating scarring disease It was linear across down her whole leg. She had contractures and everything. Um, anyway, and I took care of this girl through, a long time. You know what I mean? We've been through a lot together. And now she is 23 years old. She just graduated from college. She's about to go to grad school, and today was my last visit with her. And she and her mother and I were all in tears today because we have had this incredible longitudinal relationship. And her mother just said, "You don't know how much you changed our life." She goes, "I don't know how we found you. I don't know." I'm gonna start to cry. She's like, "But we had been through so much, and you rescued us, and you have spent the last, her entire life just taking such good care of her, and I will be forever in your debt and forever grateful." And yeah, so that was my day today. And that is all the time, all the time. That is the type of interactions that we have with people, and the effect and the outcomes that we are able to achieve with what we do. It's incredible.
Thank you for sharing that, Brandy. Um, there's a question here. How do we think peds derm will evolve over the next several years by the time that the people on this call may start practicing? What do you think is going to be new and interesting for us?
Well, I think in medicine in general, we're learning a lot more about the genetic basis of disease. And because of that, we are able to do more. Not even genetic, but genetic and then like molecular, like what inflammatory pathway is upregulated, like what can we do to downregulate it, or what gene is affected, how can we target the pathway that gene is in. And we've already seen a lot of that. But I think, I care for a lot of congenital nevi, large giant congenital nevi kids with neurocutaneous melanocytosis who have, there's no therapy. And, there's really exciting research coming out about that. And I think, the next 5-10 years, I'm really excited for that. Jim Treat, who I work with, kind of goes on all the time about the vascular stuff. He's like, "Oh my gosh, there's this pathway, and then I'm going to find the pathway, and I'm going to target the pathway, and then make this down." And you're like, "All right, this is very exciting." And if you know Jim, you know what this sounds like. And you're like, "Okay, Jim, we're doing it. We're like targeting pathway, whatever the thing is, it's going to target it." But I think that's one of the big things I think in medicine and in derm, but also peds derm, there's the patient who got treated with CRISPR recently. So like this is like the new frontier. It's like very exciting, very cool in medicine. And it's really, the thing about peds derm is that these are kids who have visible differences. And when we are able to impact them, we are able to impact them in a way that everybody can see. And so I feel like it's so powerful to be able to help a child in that way. Like they have an arrhythmia that's an inside thing. Not everyone knows that they have it, but then when they have something on their skin, it affects them from infancy to adulthood because it's always there for people to see. And so if we're able to help in some way, I think that's what I found so rewarding is like, we're helping kids, this is their psychosocial development. This is their social interaction. It's everything. And so if the next frontier is maybe to even make a bigger difference in that is like so exciting for me.
I'd agree. I think, just more broadly, I think back to, the people who trained me, they're like, we didn't have propranolol for hemangiomas back when I was training, right? We did prednisone, like we don't have all these things for like psoriasis and for atopic derm. And it feels very exciting to be like at this time where it's like, oh, people will come with these conditions that we were sort of like, here's some steroids and like maybe it'll get better, but like it's probably gonna be a rough go. Where now we actually like have things to offer and provide like a little bit more hope for them, right? And to just note there's hopefully more things in the pipeline for us to be able to offer patients is really cool.
Yeah, and I think that in addition to having more in our toolbox, including actual FDA approved drugs, which is incredible, it also it provides more opportunity for us in our careers to get involved in um, drug development, providing our own expertise to whatever researchers, industry, anyone who needs our advice. And there's not, again, there's not a lot of us, but it gives us more richness to our fields and our careers, to be able to be involved in thinking about new therapies and really having our voice be heard. So I think that by the time you guys are becoming pediatric dermatologists, there are going to be even more opportunities to have more diversity to your careers and more of an impact that you can have.
Let's shift to a practical consideration as we're approaching the end, because we're going to be a hard stop at 6:30. For people who want a career in Peds Derm, what's the job market look like? What do you think? I know that you aren't necessarily hiring, but many of you have sort of like director roles within your division or department. Um, this is going to be easy. Now is a weird moment in time because of all the things that are happening with the federal government and budget cuts. So maybe like I don't know whether it's appropriate to think like this time will pass. But what do you see for Peds Derm and our viability?
I think that if you're a pediatric dermatologist, there's like always a job for you, always. I mean, we keep hiring and we keep on having like a 6 month wait list. There's endless supply of kids who need to be seen. And like Jen just said, that there's so much you can do. You can be involved in industry, you can be involved in research, you can do teaching, you can do clinical work. There's so many ways. And there are places who have no pediatric dermatologist who want one and they have a hard time getting one. And so they would love to have someone go. And there are places where, like they have a bunch of pediatric dermatologists and they still are looking for more to, someone who's interested in, say, HS, someone who's interested in, GI disease, and all these things there. Everybody's looking to expand as our field's knowledge grows even more. Like there's even more need for us out there. I I think that, to touch on like funding, research funding, I think that clinically, it's if you're doing clinical work, that's a little bit separate from the funding insecurities right now. I think because if the patients are there, we are, in my mind, we're like seeing them, there's that revenue is there. And so sometimes I think hospitals will depend more on the clinical side, potentially to support the research side. I know that's what CHOP does, is like the clinical side, just float the research side a little bit. And so that may have to happen a little bit more. But I think that if you do a percentage of whatever percentage that is of clinical work, you'll have a job.
One other thing that I think is that I'm seeing more and more of that I think is exciting is that we're getting large enough that we can start to kind of have really like defined niches within Peds Derm that then make us attractive, it's like, oh, like we have this person who's an expert in like XYZ. This dovetails on a question that's at the bottom here, of like what type of longitudinal care and research around genodermatoses is specific in this question is encompassed by pediatric dermatology versus adult. I think that for many of us who sort of like take care of kids or for conditions that historically have been like it's a peds derm thing, either because those children didn't live to adulthood, or there's just like so few that did. Like we end up following people, a select group of people for longer periods of time. My sort of expertise is in LGBTQ health, and a lot of the patients that I care for have a hard time making that transition. And I'm like, I will keep you a little bit longer. Like once you're like having your like own full-time job, you can't be in the waiting room with like the 3-year-olds anymore. But like, yes, because it's a hard, right? Like to find that trust, especially for, an individual who either their identity makes it difficult for them to find someone who they can like trust because they've had bad experiences, or someone who just has a very rare condition that we know. We might not see it every day, but we know how to treat it, right? And they're like, we don't want to leave you ever. And I was like, I agree, but I can't see you until you're 40. But I do think like there's that opportunity. And sometimes our colleagues on the adult side are like, I don't know what to do with this patient with like tuberous sclerosis. Like, what do you think? Right. I'm like, okay, like let me help you. I think that there's opportunities for us to be able to influence our adult colleagues and help provide that care. And there are people in our specialty too who really help with like models for transitioning care from the pediatric care to adult care, that's a place where we can really have an impact also, and probably we need to do more in. But I think, you don't have to give up thinking about a person across their lifespan just because you're in pediatric dermatology, but you do have to think mostly about kids. We are getting close to the end. Anything that the three of you would like to share, just words of wisdom, anything about Peds Derm that we didn't get a chance to touch on? Um, the floor is yours.
I feel like we didn't talk about the people, like the culture and the community, which is, I don't know. I think we might all agree that that is at least one of the best parts of our specialty. It is that we love taking care of children, and with the diseases are interesting. But like Melinda said earlier about surgeons and how they're not her people, PD derms are incredible people. I mean, not to compliment ourselves, but really, like, I think if you ever come to a Peds meeting, you'll see right away that we are truly kind and love what we do and really do things because we believe it helps others. And we treat each other like that as well. Like, it's very rare for people to be competitive with one another. There's like really no reason to compete with one another. We're stronger because we help each other out. And um, it really is like a safe community, and one that just where the group is stronger than any individual. So I just wanted to make a comment about that.
Thanks for mentioning that. I totally agree. And it's like everyone's rooting for each other. Everyone's the juniors rooting for the, early careers, rooting for the later career, the later careers rooting for the medical student, like everyone just wants everyone to do well and succeed in whatever project or whatever they're doing, because they just know it's good for all of us, and it's not all, and also for the person. Everyone wants everyone to feel fulfilled in what they're doing, and it's great. I mean, like, I'm still my first SPD was when I was was I a first year Peds resident? I was a first year Peds resident, and I went to an SPD. I'm still really good friends with the people that I met in that year, and it's incredible.
I will just say, and this is not meant to cast shade on any of our other colleagues within dermatology broadly, but it is a very like big tent of people who fit under it, right? And my husband came with me to the AAD ones, and he's like, "So the people wearing like three-piece suits and like gowns are also dermatologists, and you guys?" And I was like, "Yes, we're the ones that are in fleeces and sensible shoes. So like, if you are someone who is like, I want to go to clinic in a fleece and sensible shoes." Then your pediatric dermatology is the thing for you. We don't take ourselves too seriously, but do a lot of good work, I think. Um, there's two other things I just want to say briefly. Again, because I have a big mouth, and because I think there are lots of questions in this chat about sort of like matching and applying. The first one, there's just a couple questions about being an MD PhD student and pediatric dermatology. I will tell you, and if any of the three of you have perspective on this, I think it's a very hard thing to do. It's like leaving research to do a fellowship, or like somehow squeezing that fellowship in before you do the research, because the runway is already kind of like getting ready to take you to the research. And that really needs to be your focus if you're doing 2+2. I don't want to say it's impossible. I just don't know exactly what it looks like. And one of like the most accomplished researchers like in dermatology, as far as I'm concerned, is Amy Paller, who is an excellent pediatric dermatologist. I don't know exactly what her path is, but I think that you can be both an excellent clinician and an excellent researcher. And sometimes maybe it's just like you're going to find your niche and be like the person who does that. Melinda, you have more to add.
I was just gonna say, it was actually an applicant this past year who pointed it out to us, but the ABD does have a path, a 2+2. You don't apply into it for Pete's Derm, I mean, you don't apply into it straight out. You apply for like whether that be a categorical spot or a Pete's Derm spot of some sort. And then I think it's during your first year, if you're in good standing, you apply to ABD. I don't know, Brandy, since you're on the ABD, if you know this better, but you apply and then you get accepted in, and it is, gosh, I'm gonna mess this up. It's like 2 years of derm and then you do your Peds Derm fellowship, and then you go do your 2+2. I mean, your research time, so that you then, like Marcus was saying, you take that research because it's your building block for all your grants after that. They don't want to break it up. And so you get your specialty training in Peds Derm, and then you start your funded research time to launch you into hopefully getting your K and R and every other grant you're going to get. But there is a path through the ABD to be a 2+2 and to do Peds Derm research. I think that sourced from kind of understanding the need for more Peds Derm researchers.
Thanks, Melinda. Okay, I think we will end the evening. I do want to say, like, thank you to all our attendees for being here. The most important thing I can tell you, please, like, if you're partly stressing out about like applying in derm, what's like, be yourself. Like the first things that you heard from all of us were our sort of different stories to get here, and what Dr. Wong, Dr. Canterbury was saying, just like, we want people who are enthusiastic and sincere and aren't putting up some front to be like, oh, I'm gonna pretend to be interested in peds derm so that I can get into derm. Like, be here because you want to be here and you like enjoy the vibes from the people who you're working with and you love taking care of kids, because we can tell and we want to know you. And I think too, like one of the most powerful things for me personally being a physician is when I feel like I get to share who I am with my patients. It's not every single patient, but when I'm working with queer families, like I let them know that I am too. And it just like when a child can see themselves in you, and we all have something about ourselves, no matter what our background is, that makes us special, it really speaks to them and makes them realize that like they can get that to that place also. So be yourself, work hard, keep a positive attitude. If you are a DO applicant, if you are a foreign medical graduate, if you feel like you didn't have 8 million publications, you can still be part of our community. And please like try and find that mentorship because we are here, we want to help. And there's lots of people besides the four of us who want to help, but that I think is a really great way to know our specialty better, and see if it's the right one for you. So we hope to see you as part of our training programs and as our colleagues. And thank you, to Melinda, Brandy, and Jennifer for being here tonight. I really appreciate it. I love the three of you and glad that I got to spend this hour and just hearing more about you in different contexts. I look forward to seeing you in July in Seattle. And to everyone else, thank you for being here and have a good night.
Thank you.